as most histories of this sort, it's a little devious. I came to the Harvard biology department to get my PhD in physiology of development. And then I taught for a year in a college in the Midwest, and realized that I had to have more knowledge if I was going to work with human populations, and I wanted to apply my biological training to mothers and children. And so I applied to medical school. I was accepted, received a fellowship, and had started medical school when Pearl Harbor, after Pearl Harbor, World War II, and the Army put everybody in medical school in either the Army or the Navy. And I went through, then eliminated all vacations, and I went through medical school in 3 years, and went to a federal internship in Gorgas Hospital in Panama. And there I saw severe malnutrition and dehydration in children, saw complications of pregnancy and the like, returned to Rochester, New York, where I'd gone to medical school, and started a study of nutrition in pregnancy, on which I was on call for all of the cases, all the complications of pregnancy in the city of Rochester. At that time, there were 2 other studies, one in the Children's Fund of Michigan and the other at Vanderbilt University, directed by William Darby. And let me pause there for a moment. And in the meantime, the Rockefeller Foundation had established a Food Analysis Institute in Mexico to cooperate with their agricultural program. And on the basis of that, the Kellogg Foundation had established 2 more, one in Cuba and one in Ecuador. And the Minister of Health of Guatemala heard about this and asked the professor of nutrition at MIT, who had advised the institutes in Cuba and Ecuador, to get support from the Kellogg Foundation and help them set up a similar institute in Guatemala. He replied that it should be much broader than food analysis. It should be public health nutrition, and it should include all the countries of Central America and Panama, that Guatemala was too small. So the Minister of Health convened the Minister of Health of Guatemala convened the ministers of the other 5 countries, and they agreed on a proposal to the Kellogg Foundation. The Kellogg Foundation agreed to provide 3 fellowships for each of the countries in advance for people to staff the institute, to provide $15,000 a year to PAHO for the salary, secretary, and travel of the director, and they all agreed to pay $8,500 a year as a quota. Well, only Guatemala, El Salvador, and Honduras formally ratified and began paying their quotas. Well, about 2 years later, Fred Soper, who was then the director of PAHO, was told that this money was piling up and what were they supposed to do with it. And that was when the decision was made to follow through with this project. And the person they asked to be the director was William Darby of Vanderbilt. He was also already quite well known, but he was unwilling to leave the United States or to accept the offer. And he recommended me because he knew me through the Rochester Pregnancy Project. So one very hot July, I drove out from Rochester to Washington and had an interview with the famous Dr. Soper. And to cut a long story short, he offered me the position, and I was very happy to accept it because it fitted in with all my training and interests. But my professors were very distressed. They thought I was throwing away a promising career. And of course, it turned out to be a wonderful opportunity. But that was when the die was cast that I wasn't going to be a professor of clinical medicine. I was going to be a public health nutritionist. The fellows chosen by the three countries ratifying the agreement were sent to a special course that Professor Harris set up at MIT. And one of them was sent to my laboratory to learn the ultramicro methods for nutrition, for measuring nutritional status that was only available in one other place in the country. And that was, the person was Guillermo Arriavi. And he turned out to be a leader and later a very outstanding scientist. But at that point, he was a licenciado in pharmacy from Guatemala with this year at MIT. Well, the equipment had been picked out and shipped to Guatemala, and he was went down in June to get it out of customs and to see about setting up the laboratory. I came down in July and found that the INCAP building was an adobe one with a tin roof in the botanical garden that had three small offices, and then a larger one that was planned for the field team, and three potential laboratories for agricultural and food chemistry, for the biochemical, microbiochemical measurements, and then one for other laboratory procedures. And that was it. And at one point, there was a attempted revolution, and a bomb was dropped we didn't know where it was going, but it ended up outside the door of the radio station a block away. But we were huddled in the room that we thought had the thickest and most protected walls. And one time, Arriavi actually was the one who came in and said, you know, they're setting up a sandbag machine gun nest outside the corner of the building, and there's a row of soldiers lying along the building with their rifles pointed to, well, what was the Polytechnic School for the Army next door. Well, that was the environment, and about there was at that time when I came down, there was no floor. The gas and vacuum and so on hadn't been in, and they were planning an inauguration for the 15th of September. when I came down, I came down in July, this looked kind of impossible, and it looked. I wondered how we would make out with this adobe building. Well, we made out just fine, and there was the inauguration did come off on the 15th of September, and INCAP personnel were already beginning nutrition surveys in the countryside. Well, I'll tell you the inside story. And that is that Castillo Armas was elected president, the first elected president that Guatemala had had for, I guess, pretty much all of its history. And at the same time, it was obvious that we couldn't continue to grow and function in this INCAP, in the adobe building. And after Arbenz was elected, but before he was inaugurated, I arranged through friends to have an interview with him. Well, I came to his house, and he was in another meeting, but his wife took me into a room and sat down. We had tea, and I told her the INCAP story, and also that if Guatemala wasn't interested in providing adequate facilities for INCAP, either El Salvador or Costa Rica would be glad to do so, and that this would be a great loss to Guatemala, and so on. And after we talked a little while, she said, well, I think my husband should hear this. And so she called him out of a meeting, repeated briefly what I had said, and I had said a few more words, and said, I'm convinced, held out his hand, you'll get your building. And so he was inaugurated. A few months went by, nothing happened. And I went back to the same friend and got an appointment with him again, this time in the Palacio Nacional. And he said, well, I've been kind of busy since I've become president, but you'll get your building. And the next week, he presented to the cabinet approved funds to draw up plans for a building. The irony of it is that as the building was essentially finished, there was a coup, he was overthrown, and the new government decided that inaugurating the INCAP building would be the first of their administration, and they put extra workers on to be sure it was finished for inauguration on September 15th. I went to Panama, was met by the Director of Public Health to try to urge Panama to ratify and become a member of INCAP. And since I'd interned in Gorgas Hospital, I knew lots of people in Panama, and they said, you're wasting your time. There's going to be a coup, and so is going to be the president. I said, well, how do I get to talk to him? Well, we'll arrange it. So I came down the next day into the area of Panama that you know, Salas-Cipueda, and a little lawyer's office, sort of disreputable and so on. And without any indication of why, I told this fellow all about the INCAP story and why Panama should be a member and so on. Well, there was some pretext because he was chairman of the committee that was considering it, but I knew he was the one that they expected to be the president. So I was back in Washington the next week, and in Pajo, and they'd asked me about Panama becoming a member of INCAP, and I said, well, I visited Panama last week, and the director of public health assures me, etc. That's all I said. Well, the next morning, the newspapers had the headline, "Coup in Panama," and this fellow that I'd visited in a lawyer's office was the president. And they said, well, what are you going to do now? I said, I've already talked to him, and he's agreed. At any rate, the papers the next morning, a second coup in Panama, and then a terrible person came in from Panama, Arnulfo Arias. And so a few weeks later, I was back in Panama, this time going up the stairs of the Palacio, and at all of the corners of the stairway there were guys with guns and bayonets, and I walked into the office of the Arnulfo, and it was filled. Just every chair was filled, people waiting to see him. And I was ushered in to see him. He had an office about the total size of this room, maybe a little larger, and he had, the only furniture in it was a desk off in one corner and a few chairs. And the guard with his bayonet and so on went out and closed the door, and the two of us were sitting there talking. And we did get, Panama did come in to relatively soon. And I didn't mention that we started with a budget of $24,500, plus the $15,000 that Kellogg gave to Pajo for my salary and a secretary and my travel. But as the other countries came in, that of course became what was it, 49,500 at any rate, and then the quotas went up from 8,500 to 12,500, and we began to get grants, and the budget expanded. But that's where we started.